In this video, we're going to show you how to customize your patient health questionnaire. Every clinic asks something a little different, so this form should be yours. Before any operation, every patient fills in a medical history questionnaire. It is the form that asks about allergies, heart and chest problems, the medicines they take, and so on. Velastria gives you a complete one, ready to use on day one. But no two clinics ask in exactly the same way, so you can make it your own. There are two kinds of question on the form. Core medical questions are the safety backbone, the ones a surgical team relies on. You can reword them, reorder them, and hide any you do not use, but you cannot delete them, so nothing important is ever lost. Custom questions are your own. You can add them and remove them whenever you like. Let's open the editor. The quickest way to reach anything in Velastria is quick search, and you can call it up from any page. Press Command K on a Mac or Control K on Windows, and the search box opens. Type what you are looking for. Here, medical history. And open the Medical History Questionnaire editor. Here is the whole questionnaire, laid out section by section. Each question shows its wording, whether it is required, and whether the patient can see it. Let's make a few changes. To change how a question reads, just click into its wording and type. We will rename preferred name to preferred first name. The patient now reads your wording, not ours. If a question does not apply to your clinic, you do not delete it, you simply hide it. Untick visible to patient, and the patient never sees it, while the answer still has a home in your records. Here we hide occupation. Notice it fades, but it stays in the list. Scroll down to the medical questions and you will see two badges. A blue lock marks a core question. You can hide it, but never delete it. An orange badge marks a safety question. If a patient answers yes to one of these, the theatre team is warned automatically. So Velastria always checks with you before you hide one. Now let's add something of our own. Click Add Section, and a fresh empty section appears at the bottom of the form. Give the section a name that patients will understand. Inside it, click Add Custom Question. Type the question you want to ask. Then choose the kind of answer you want, a simple yes or no, a text box, or a pick from a list. We will make this a pick from a list. Add the answers patients can choose from, such as found us on Google. You can keep adding as many choices as you like. When you are happy, click Save Changes. Your updated questionnaire goes live for the next patient who fills it in. And here is the reassuring part. Every questionnaire a patient has already completed still shows exactly what they were asked at the time, word for word. That is how you make the Medical History Questionnaire your own. Reword questions into your clinic's voice, hide the ones you do not need, and add your own sections and questions. The medical safety backbone is always protected, so you get a form that fits your clinic without ever losing what keeps your patients safe.